The gummy elastic bougie can be a useful aid in the intubation of a patient with a Cormac laryngeal grade of 3 or 4. A standard curved laryngoscope blade or McCoy blade is used to visualize the glottis. The combination of a bougie with a McCoy laryngoscope blade and external laryngeal manipulation are especially effective tools in managing a difficult intubation. Partial flexion of the tip of the McCoy blade can be used to elevate the base of the tongue and epiglottis and improve visualization of the glottis. The tip of the bougie is advanced just under the epiglottis, between the vocal cords and into the trachea. The laryngoscope is positioned to optimize the exposure of the glottis. A grade 3 or 4 Cormac laryngeal grade may be improved by 1 or 2 grades with the use of a McCoy blade and external laryngeal manipulation. Confirmation of tracheal placement can be confirmed by visualizing the bougie passing between the cords, tactile sensation as the bougie passes along the tracheal rings, or resistance to advancement as the bougie enters the lower bronchi. Laryngoscopy is maintained while the bougie is then used as a guide over which the tracheal tube is advanced into the airway. Tracheal intubation is confirmed with capnography and auscultation of the lung fields.
Next, we will demonstrate a direct laryngoscopy on this patient using a gum elastic bougie. Gum elastic bougie is often used for both anticipated and unanticipated difficult airways, often grade 3s and sometimes 4 laryngoscopies. Here you can see that the bougie has an angulated tip, as well as has 10 centimeter markings along the length of it. Beforehand, this should be lubed up, and it should also be twisted in a circle in order to approximate the radius of the pharynx. You would do your normal direct laryngoscopy, introducing the scope, and when you could see the epiglottis or even the posterior glottis, you would introduce the gum elastic bougie in through the mouth under direct vision. When this is introduced, sometimes you are required to lift the epiglottis with the angulated tip. Otherwise, you would pass it under the epiglottis and you would feel for one of 2 endpoints. The first being the tracheal rings grating against the angulated tip. You may also be required to pass it until it stops. If the bougie does not stop by approximately 25 to 30 centimeters, you would have to assume that it is in the esophagus. Here we have stopped at around 22 centimeters at the teeth. It's important to keep the direct laryngoscope inside the mouth as the endotracheal tube is being placed over top of the bougie. An assistant would help thread the endotracheal tube over the gum elastic bougie, always maintaining that someone has a hold of the bougie. The bougie would then be railroaded over top of the endotracheal tube would be railroaded over top of the bougie, and once set at the correct depth, the bougie would then be withdrawn. From here, again, the cup would be blown up with air, and the endotracheal tube would be secured as it